Welcome to the ISHLT Infectious Disease Professional Community Town Hall meeting. We have one of these a year, and it gives us an opportunity to have some new members and interested people join, and also to just discuss how the year has been going and how people on the call can participate in our activities. I apologize. I'm in Montana for a meeting, and I kind of had to give some talks today, and my voice is a little gone, but I'll do my best. Just let me know if you're having trouble hearing me. All right, so the agenda today, we'll talk about the membership leader group. Then we'll give membership statistics for ISHLT and the ID group. We'll speak about the things that are happening at the annual meeting in Boston. And we'll talk about 2025 planning, and then talk about some other accomplishments and good activities we've had throughout the year. It'll probably take about 15 or so minutes to go through the slides, and then the rest of the time we can use on discussion and any questions. And actually, if you have any questions along the way while I'm presenting the slides, please go ahead and just speak up. All right, so this is our stellar group here. I'm John Badley, and I've served as the chairman of the PC committee for the past year. And I'm also on the MCS group. Cam Wolf is a newer member on the advanced heart failure group. Stephanie Pouch was our former chair and is a representative to the PVD committee. Emily Eichenberger is representative for the lung transplant group, and she's been on our panel, I guess, a couple years now. Fernando Silveira represents the leadership advisory group. And finally, Rebecca Kumar, who was serving as a representative to the early career and trainee committee. And so I've been lucky to work with this team. It's been a fantastic group. And I will mention that Cam Wolf will become the chair in my position starting in May after the annual meeting. So we have some newcomers on the block, and we want to welcome them as well. First of all, we have Yo Natori, who will serve as the Pulmonary Vascular Diseases Interdisciplinary Group representative. Also, Maddie Hellman will be an early career and training committee representative. And finally, Jennifer Chow will take my place on the Mechanical Circular Support and ID and Steering Committee. Again, we're excited to have these three people join us, and we're excited to see what they can do. So we'll first talk about professional community membership, and this represents all of ISHLT. And as you can see, the ID group comprises about 3% of the total members, with the largest being cardiology. And so 2023 is listed below, and it was 4%. Even the fact that our membership has increased in ID, we still have a smaller percentage of the total pie because of general growth in the ISHLT membership. You know, one thing to point out, and we've talked about this before with Greg and others on the call, is ID docs don't make quite as much as cardiovascular surgeons, and it's sometimes harder to be a part of lots of committees. And there are 4 or 5, not committees, societies. There are 4 or 5 competing societies for ID, for transplant ID clinicians. And so, you know, I think probably that is part of the reason we don't see more people in our group. It's just hard to belong to lots of different groups. And so one thing we can discuss is sort of how to try to make our membership grow. These are some slides, by the way, that Juliet put together, and Juliet, I want to thank you for that. These are general ISHLT membership demographics for the 2024 member year. And if you look at the top left in that pie chart, you can see most of the membership of ISHLT is physicians, about 70%, a few non-physicians, and then some trainees. If you look at the middle pie chart, the non-North America membership is growing, and that's actually been an emphasis of ISHLT. Definitely, it's considered an international society for transplant, and we absolutely want to expand our horizons. So that's good news to see that that's happening, although slowly. And finally, if you look on the right, as you remember, when you sign up for a community and you join ISHLT, you have an opportunity to have a primary ID affiliation primary affiliation, and also a secondary affiliation. And this pie chart represents the primary affiliations. And so of the ID members, 45% are heart, 35% are lung affiliations, and then there are several others. So, one thing we'd like to do is talk perhaps on how to increase the early career and trainee membership in our group. It's important to know that we are growing this, and really in the last year, 2023, 30% of our ID membership was early career, and I think that's fantastic. I don't have the numbers for 2024, but 30% of our membership is great. Excuse me. And some more statistics, thanks to Juliet. These are our numbers over the past several years. And importantly, well, there we go. We've had a 54% increase in ID membership since 2020. And that is just absolutely fantastic. Last year, it was about an 8% jump. And as you can see, every year we are increasing. And I think that's really important. And the past several membership groups have really had a great effort in doing, especially Stephanie last year was really pushing the membership. And so we're really happy, and we want to see it continue to grow. And if you look at the in general, hang on, sorry. And if you look at the bottom, the member types overall, you can see physicians are most common. And then the top, you can see again, cardiology with that many members. And so really 3,500 total members in ISHLT. That's pretty impressive. All right, so let's move on to the meeting. I hope you guys have signed up for the 45th annual meeting, which will be in beautiful Boston. And that's why the lobster's at the top right, at the John B. Hines Veterans Memorial Convention Center. And Juliet, I don't know if you have the specifics, but about registration, I believe early, cheaper registration ended last week. Is that correct?
Yeah.
Do you know?
Yeah, that is
okay.
correct. Yeah.
Yeah, but still plenty of opportunity to register. And the hotels, I did not look at the hotel data on the site. I think a couple of the major hotels are filled, but there were plenty available around the Boston area. And so I would advise you to go ahead and sign up if you can. And it's going to be a great meeting.
Yeah.
Greg, you have any comments?
Well, we received over 2,000 abstract submissions, which was a record, and we're expecting 4,000 people at the meeting in Boston. Registration is a little bit more, it's about 2,300 so far, so we're a little bit more than halfway there.
Fantastic, thank you. And there are some important pre-conference workshops, just to let you know. We had discussed having an ID pre-conference workshop over the last couple of years, and hopefully we'll have that in the next couple of years. But right now we have these offerings right here, and please sign up for them when you register if you're interested. And let's talk about the ID content. I went through the program this week, and really there is some impressive ID content. And I want to say we have a lot of good representation from our community members, and more importantly, a good mix of old and young and wide geographic distribution. So it was really nice to see that balance among our speakers. And just to give you some examples here, we have a donor heart issue, and a CAM is speaking, I believe, there. Hot-blooded infectious complications in patients with MCS. Teamwork, early career potential with Laura Danziger speaking. Mycobacteria, infectious showdown. Are you ready for a pig heart? With, I think, Sapna speaking. And rare but serious pulmonary vascular diseases, where Tina Stosor speaking. Innovation and integration of novel surveillance biomarkers. That is, oh gosh, I can't remember our representative. But we have really a nice panel, and these are all important symposium. And if you look at the second slide, look at the number of oral sessions that contain ID-related content. And again, many of our speakers, including early career speakers who are presenting posters. And so I've been quite impressed. And then finally, we have a number of posters. I don't know exactly how many ID posters we have, but a number of poster sessions featuring ID-related issues. So let's talk about some meeting issues and meetings. And so tentatively, we will have our IDPC reception scheduled from 6 to 7 p.m. Eastern on Monday, April 28th. And that's still set in stone, right, Greg and Julian? Okay, okay. One thing we had in the past, and I forgot to mention it to you on the last call, Greg, is our ID group had met to plan for the next meeting, kind of a breakout session. Are we able to schedule that, you think?
We can get a room, yeah.
Okay, so we'll have to figure that out because that's been very helpful for us to kind of get a hold of the next year's content.
Yep.
And then there are other ID and breakfasts, the MCS, the heart and lung, et cetera, for those of our members who need to go. All right, so let's talk about symposium planning. The proposals are typically due in the late 2025, and planning typically starts at the annual meeting or could start today on the end of the call. And so, whoop. Okay. And excuse me. And so, you know, the meeting that Greg just talked about at the ISHLT annual meeting will be a good opportunity to kind of get together, because when all the topics are sort of fresh in your head, you can know what to think about for next year. And I will say that I was very impressed with our group this year. We had a couple of Zoom calls, if you know, with over 60, 70 people participating. And we had, I think, 40 of our members work together to put together these symposium ideas. And these were the 7 that were accepted in part or in whole, and actually mostly in part. So the first slide I put up about symposium, you can see bits and pieces were chosen, several moderators and speakers, and then that was mixed with other IDNs. But I mean, we really have been successful in the past 5 years of putting together great content. It's not always accepted, but it's still excellent content. And I think, you know, every year we're trying to work hard and push Greg and others to get more ID content in the meeting. But you know, Greg, I mean, you know how hard it is and how many people there are and how many submissions there are every year. And there's just not enough room sometimes.
It's a lot of competition.
Yeah, but I think we did really well. And so hopefully in June, Cam can lead the group to set up these Zoom calls again and develop new content. So just a little bit of some highlights from the year and some accolades. So first of all, the ISHLT Standards and Guidelines Committee that sort of is involved with reviewing and kind of sending out proposals and everything for typical guidelines. First of all, Saima Aslam is the lead author on the ISHLT infectious disease mechanical support system guidelines that were published this year. So we thank Saima for that work. Also, we had begun to work on 2 different proposals, one for the management of Candida and Aspergillus infections in temporary and durable mechanical support, and also for the diagnosis and management of fungal infections in lung transplant patients. And so we submitted these ideas to the guidelines committee, and we got some comments, and we resubmitted some things, and we got some more comments. And actually, it turns out that there's now an ISHLT open journal feature topic, special topic on fungal infections. And so I think probably the first 2 here, we're going to kind of rethink our strategy and really determine if some other ideas may be more beneficial, because there will be some overlap if we proceed. So Stephanie and I talked about that this week, and we'll need to kind of think about next steps. Other ideas for documents were brought up by several people who emailed me, but one of them is CMV. You know, we have a lot of CMV guidelines nationally in different societies, but a focus of CMV recommendations among lung transplant or heart transplant only does not exist that I'm aware of. And so that might be an opportunity to push that. Other things that we all agree on that are important are diagnostic and antimicrobial stewardship. And so the way it typically works is our ID community will put together 5 or 6 different ideas of what we think is appropriate. We will also look back at the past published ID guidelines and then submit them to the S&G committee. and work with them on what might be the next steps. And these are big documents, and it just does take a while to get them through. Finally, if others in the group are interested in participating in standards and guidelines, not necessarily an ID, there is a volunteer site on the website where you can submit your name and be on one of the many panels, because it's certainly important to have ID representation on non-ID guidelines. Just a couple of other highlights for the year. In collaboration with TID-TTS, we as the ID community thought it was important to put together a measles document, and it's certainly apropos now as you can see what's happening in Texas. So this was a joint collaboration with TID-TTS and ISHLT. It was a nice thing that was led by Stephanie Pouch, and people on the right there also were involved. And we really appreciate all the volunteers that helped with this document. The document was published in June 2024, and it's a really nice piece. And actually, I've gotten a lot of non-ID comments from, heart and lung people that said, wow, that's a really helpful thing. I put it as a PDF on my desktop, and it's really come in handy. So I applaud that effort led by Stephanie Pouch. Also, this document is being made into a manuscript as well, which is in preparation, and that's led by Stephanie as well. So we're excited about that. So in this committee, we do have the opportunity to get people active and do things which really benefit our patients. All right, and finally, other activity are the professional community webinars. And our last webinar was in June 2024. That was specifically through ID anyway. And as you can see, quite a number of participants, and then 217 YouTube views, which is the second highest among all the groups. And so we are excited about that. And it was an absolutely fantastic webinar. If you missed it, I would recommend that you look it up on YouTube, because it has some great speakers. Moderators were Maheen Abidi and Bradley Gardner. And the topic one was New CMV Drugs by Jennifer Chow, which was excellent. CMV and telomere disease from Maria Budav, which was also excellent. And then finally, Oriol Manuel gave a really nice overview of the cell-mediated immunity tests available in the market and how and why they apply. And so again, those were really excellent talks, and we got some good feedback about that session. So webinar topics for 2025 and 2026, and we had planned to have a webinar shortly after the meeting in May, really thinking about the content that was not accepted this year to ISHLT and maybe spinning that off into a webinar. And as you can see, there are some other webinar topics that were very popular among our group, and I'd love to hear everybody's thoughts, but certainly fungal infections and bacteriophage use for resistant infections was a hot topic. Frailty and infections as well as CMV again, MDROs, and then tricky donor and recipient cases. And I believe Cam and Maddie and others put together a really nice symposium on donor and recipient cases that was not accepted at the annual meeting this year. And we thought that perhaps that might be a great way to incorporate, some CMV and MDROs and fungal infections into more of a donor and recipient case series. And so we would love to talk more about that. And finally, JHLT Open, as I mentioned earlier, will have a special topic issue focused on infectious diseases and thoracic transplants. The guest editors are Dr. Shahid Hussain and Mei Lin Long. And again, many of us in the PC group have been asked to participate and submit articles, which I believe the deadline is April or May. So we're excited about that. And again, there will be some overlap with our proposed fungal guidelines. And so finally, once again, I want to apologize because my voice is kind of going in and out. I apologize if it was difficult to hear me, but I want to thank all of you for your time and engagement. This is one of my favorite committees because we have a lot of caring people who like to be involved, and it's not hard at all to ask for volunteers. Everybody wants to help. And I think we've had successful content and webinars and proposals and really made the ID group in ISHLT an important part of it. And so I think one of the goals would be certainly to continue to increase our membership and also to continue to get more involvement among the members. That's all I have. Any other comments or questions? Or Greg, or did you want to say anything as well?
I do have a question. So if back to your comment earlier about, people have limited funds to join multiple societies. If we were to look at partnering with an ID focused organization and producing some joint programs, what organizations would be at the top of that list?
Yeah, so again, as you know, Greg, we've talked about this before, but there are multiple transplant ID related groups. And certainly there's the AST IDCOP, which is a large one. There's the Transplantation Society TID group. There's also the Immunocompromised Host Society ICHS, which is focused on transplant and cancer. And there's also the ECMID group called ESIGH, I believe. Someone may correct me. And so that's 4 or 5 there. In addition, the Infectious Disease Society of America has just started a transplant and cancer ID sort of subgroup. And so again, that's 5 groups. And so to belong to all of those societies adds up. And certainly for our trainees and our early career providers who have smaller salaries, it's challenging to do that. And it's also challenging, as you can imagine, to go to all the meetings. And so, people sort of have to be selective. And so I think that's just it's great that we have all these things, but it certainly makes it challenging to be a member of each one.
Yeah. I appreciate that. Yeah, the goal is not to duplicate what others are doing, but rather to partner up and consolidate.
Yeah, and I think certainly it's important to think about webinars, right? When we've done some webinars where we've used the lung group and we've used other groups. I think that gets also an international appeal if we can do that. And so, TTS and also ECMID subgroup are all international, and we can bring together a broader audience, I think, if we think about that.
Yeah. I just wanted to take a moment to thank you for your excellent leadership over the past year. Just outstanding.
Thanks very much. It's been easy with my superstar team,
It's a great team.
I tell you what, I forgot something now that I'm staring at Rebecca's face, and so so maybe she might want to say something about the emerging sort of infection public health / committee that we wanted to start in our group.
Yes. So I am looking for somebody senior to partner with. I did post something on our on the listserv earlier about this, but I can definitely reach out to people to do that.
That kind of group to be. Can you give a little summary for the crowd here?
Yeah. So because of the fact that we've had, all of these recent outbreaks, including measles, Mpox, and our transplant patients have very unique needs. One of the things that we had talked about doing as a group was having a sort of committee that could meet together, come up with the educational information and advice for providers and clinicians in order to better educate their patients on these issues. Sort of what Stephanie Pouch did with the measles outbreak. And so I think our hope is to be able to have myself, somebody else lead it, and then work with like a group of volunteers to be able to put out things as needed when new outbreaks emerge.
No, I think that's a great idea, and I think you failed to mention avian influenza, right? Which is in the news every day. So I think it's a great and opportune time to get that committee together.
Exactly.
Yeah, let us know if we can support from headquarters. If you want to put a post on ISHLT Connect in the open forum so that everybody gets it, soliciting interest, I think you'd get some people.
I think one of the pediatric members might be excited about that as well. It'd be wonderful to have some of them. Great. Any other questions or comments today?
Hi, my name is Stella. I'm actually a second-year general ID fellow down in Dallas with Dr. Lahaz, going to be doing transplant ID next year. But sort of going to Dr. Schultz's remark about, are there areas to sort of maybe partner with other organizations to try and increase particularly fellow trainee membership and early career membership? And I had the opportunity to attend the AST Fellows Symposium earlier this year, which was just a fantastic opportunity. And I think that there possibly may be opportunities there to provide more partnership with some of these other societies, because I think one of the downsides is a lot of the, particularly fellows, I think, and general ID fellows who may be interested in transplant are less aware of all the different ID groups that are out there in societies that are available to be involved in. And so that might be a really great opportunity to sort of explore sort of extending that to other trainees.
Yeah, I think that's a great idea. And again, as we talked with earlier with Greg and Stephanie had worked with Greg last year about this, doing a pre-ISHLT conference workshop that is ID focused only, and that would be kind of a general nuts and bolts of transplant ID, but also include a lot of early career activities. And so we still want to try to push for that in the next year or two. But I love your idea. I mean, I think as the WTC meeting this summer, which is involving TTS, AE, STS, and ATC, will have sort of a conference workshop on ID stuff that will be inviting fellows as well. Great idea.
Yeah, great idea. And we are still pushing for that pre-conference ID workshop, possibly in partnership with the pharmacy professional community at ISHLT in 2026 in Toronto.
Awesome. Thank you, Greg. Any other questions or comments? Well, I do want to thank Juliet and Greg for being so supportive and sort of keeping me in line all year with my emails and meetings and everything. It was very helpful. But I think we've had a great year, and I look forward to Cam taking over and continuing the excellence of our group. If that'll be all, I guess, and we can conclude a little bit early. And thank you for joining us today. And if you have any questions or comments that weren't asked today, then please give me an email. I'll be happy to try to answer.